you to tell me about it. First, what is skill to care? What does that specialization involve?
Yeah, it's a really cool program. It's out of Thomas Jefferson University. My boss, Kara, introduced me to it when I came on to Home Therapy Solutions. So it's really looking at the person with dementia, their environment, and their caregiver, and what combination of factors between those three things might be leading to behaviors, which could be anything from repeating sentences, or it could be some higher level behaviors such as, aggression, acting out, things like that in their environment, their home, that really makes it hard for the caregiver to not get burnt out and provide the best level of care for their loved one.
And I can tell you from personal experience, I've had family members that have gone down the road of cognitive decline leading to dementia. It's such a challenging situation, not just for the patient, but for the rest of the family. There's so much confusion. There's so much, even we don't understand really about what is the best way to interact and engage and what do we do? How do we deal with this? So, with you being an occupational therapist who works with both patients and families, what are some of the things that you do? When do you come into the patient situation? Tell me a little more about like what a family could typically expect working with you.
Yeah, so the sooner we can get in, the better, because even if you're
Mhm.
not seeing a lot of the behaviors yet, you might down the road. So the sooner we can start, the better we can prepare the caregiver for what's ahead. Like you said, you might not know a lot about it, how to react to it. So it's really working on making sure the caregiver understands where the client might be coming from and then how to best communicate with that person to decrease the behaviors, decrease their agitation. Because you can imagine that as a person working with someone and them not being able to understand you, but you feel like you're communicating effectively, how frustrating that can be. And if we can eliminate that, how much smoother it is for the client and the caregiver. Really,
Yeah, I know.
both as comfortable as possible in that situation.
Yeah, I know one of the biggest challenges that we faced was there wasn't even a physician that was saying, "Hey, go connect with an occupational therapist who specializes in this kind of condition."
Yes.
So my wife, her sisters, they were doing the research on their own. Let me ask you, because I know that there are families out there right now who are kind of lost and confused. They're doing research, trying to figure it out. Can they come to you directly? Do they have to go through a physician, primary care physician or anything? Or are they able to reach out to you and say, hey, we know we need help. We don't know what we need, but we know we need help.
Yeah, I mean, none of us really know what we need, right? So, yes, you can contact us directly at Home Therapy Solutions, and we take care of the rest of it for you. We reach out to the doctor to get a referral, just best practice to get that, and so that they kind of know what's happening with the patient's care as well. But we like to make it as easy as possible for the family, take away those steps that they worry about, and so they can just contact us directly at Home Therapy Solutions.